Welcome back to Data Protection Gumbo. I am your host, Demetrius Malbro, and I have the pleasure of speaking with John D. Cook, who is the founder and CEO of John D. Cook Consulting. So, John, welcome to the Gumbo. How are you?
Just fine. Thank you very much for having me on.
All right. So, John, welcome to the show. Why don't you start off by telling us about your consulting business?
My background is in math and statistics, and that's the main thing that my consulting business does, and especially data privacy. So I came into data privacy from the statistics side, and that's our main focus now.
And let's talk a little bit about data breaches and also what happens when there is a cyber breach within your environment. And also, you know just as well as I know that it's a challenging time and it's also a stressful time when that happens. And so maybe why don't you walk us through what can happen to a company data has been breached, and also especially if it is dealing with healthcare.
It's not a fun time. There's a lot of things to think about. I appreciate your recent guest that was talking about all the steps of complying with SEC rules and even gaming that out ahead of time to be prepared. So I focus on the HIPAA end of things.
Okay.
And so if you have healthcare data that's breached, then in particular, you're under HIPAA regulations, reporting regulations. You have to report to the authorities. You have to report to individuals. You have to let
Hmm.
people know what data was breached. And if you have more than 500 people in the data breach within a state, then you have to notify news media. At a minimum, it's a hassle. And of course, there's also the possibility of large fines. But whether they're fines or not, you
Hmm.
have the loss of goodwill with your patients.
So there's a lot of things that can happen, and so I appreciate you bringing those up. Also, when someone breaches your network and you actually discover and find out that they are actually there, because sometimes there's months, right?
Right.
Weeks or days go by. There's a dwell time that they're actually running laterally throughout your network and looking for different systems and assets that they can actually take over and control and even encrypt your data or exfiltrate your data. And so let's talk a little bit about some other methods on how to continue to keep that data safe, things like maybe what encryption or also hashing. You want to talk a little bit about that?
Sure. So there's something called breach safe harbor that basically says it's not a breach if you breach encrypted data, but it's not quite that simple. The HHS Health and Human Services guidelines basically say you have to encrypt data well,
Hmm.
meaning it has to comply with standards. That's not a regulation, but that's guidance, and they reference NIST guidance documents.
Hmm.
So even saying your data is encrypted is not enough. You have to be able to defend how it's been encrypted. Also, for a while there, Tennessee revoked their analog of the breach safe harbor, where they said even if your data has been encrypted, you still need to notify the state when there's been a breach. And then they backpedaled on that and said that you don't have to notify about the breach of encrypted data if it's been encrypted per the FIPS standards. So that's in flux. Even if there aren't laws requiring notification now, there might be. There could be other things like Tennessee where requirements come and go.
So just going back to trying to make sure that companies continue to keep their data safe and out of harm's way. We also hear in the news that when a large breach happens, that they get access to your names and social security numbers and addresses and all different types of PII and private information. Now, I've also read somewhere that you can do things like removing your name and your phone number, but why isn't it enough to just remove things like your names or your phone numbers?
Right. Well, people used to think that was enough. And then in the 90s, Latanya Sweeney made a big splash by re-identifying public, supposedly de-identified health records,
Hmm.
and was able to give the governor of Massachusetts a copy of his medical records that she was able to find by cross-referencing health records with voter registration. So
Okay.
that's when she found out that if you know someone's zip code, birth date, and sex, that's enough to identify the majority of Americans.
Wow.
Yeah,
That's scary. That is
and
scary.
yeah, well, and since then, people have taken her research literally and said, okay, we're not going to include 5-digit zip code and date of birth, but that's just an example, right?
Hmm.
There's other things you can do to re-identify people. A famous example was the Netflix prize, where they made public very thin,
Hmm.
so movie ratings and dates, and maybe not much else. But
Hmm.
then shortly after that, some researchers were able to cross reference the Netflix data with public IMDb data
Hmm.
and re-identify some people, like, oh, here's somebody who gave Babette's Feast 5 stars on Netflix, and here's somebody who gave Babette's Feast 5 stars on IMDb around the same time. So yeah, maybe
Yeah.
they're the same person.
Wow. Great info. And also, I was doing some reading as well, boning up right before you came on here, and I saw something that was an acronym, BAA. Maybe you want to talk about that, and I don't know if people should sign one or not, or is that something that first, I guess, what is it,
Yeah.
and maybe why somebody should or shouldn't sign one of these.
Right. So the HIPAA privacy rule applies to covered entities, where a covered entity is basically a hospital, some kind of healthcare provider, insurance companies, but then it doesn't directly cover accounting firms.
Hmm.
But if an accounting firm is doing services for a hospital and they receive personal information, then they are a business associate of the hospital and they sign a business associate agreement, which basically means they come under the same kinds of regulations as the hospital itself. So
Okay.
they have to have the different security policies and so forth. They're subject to breach notifications. They're subject to basically whatever the hospital was required. So a lot of companies will seek to avoid signing a business associate agreement if they don't have to. I mean, maybe it's their full intention to keep the data private. They're doing all they can to use best practices and so forth, but they just don't want the burden of going through the business associate agreement process and
Hmm.
having to follow the letter of all that entails.
Okay. Got it. Got it. That is the first time I have ever heard of that, and so I thought I was well versed in HIPAA and all things HIPAA. But
Well,
if you
I'll
don't
have
look at, yeah.
clients that'll say, we're doing this service for this hospital, and we need to de-identify this data. And I said, well, why don't you just? I mean, you're a business associate. Why don't you just sign a BAA and be done? Then you don't need me. And they'll say, well, we don't want to sign a business associate agreement. We don't
Mm.
need identifiable
Hmm.
information to do what we're doing. So we'd rather get around that.
Okay. So you mentioned that they won't need you, but why would a company need you
Yeah.
anyway?
Okay. So if if a source of healthcare data wants to commercialize their data,
Hmm.
say they've got data on often millions of people, and they would like to de-identify that data and sell it to a marketing firm or pharmaceutical company or something like that.
Oh, okay.
There's two ways they can do that. In the HIPAA privacy rule, it says you can go safe harbor or expert determination. Safe harbor means there's a list of things your data can't contain: phone numbers, social security numbers, names, obvious things, and dates of service is
Okay.
one of the things. Again, going back to Latanya Sweeney, she found out you can use dates of service to connect people to things that have been reported in the news and identify people that way. But dates of
Hmm.
service are critical for making the data useful for a lot of people. And so then they go with the second option, expert determination, and that's where I come in. So with expert determination, a statistician can sign off and say, yes, this data has been adequately de-identified. There's low risk of re-identification. And now you can go ahead and sell the data or whatever you want to do with it.
Okay, maybe we'll have to get LaTanya Sweeney on here with this one
Well, that'd be
on
great.
the next time.
Yeah.
She might be a busy person, and it might
Yeah.
be hard to. I'm sure she's in your Rolodex, right?
I haven't met her yet. Yeah.
All right, and let's talk AI, right? Everyone's talking artificial intelligence, and NVIDIA and
Mm-hmm.
GPUs and data centers are blowing up, and not literally blowing up, but
Hopefully not.
they're getting very, very, very in the news, and everyone is talking about the resources and the energy. Like they're super hungry for resources and energy and power and cooling, and all these chips have to be powered. Where do you see AI fitting into this entire data privacy realm?
Well, I've seen it two ways. A lot of my clients want to provide data to an AI.
Hmm.
So they're wanting to de identify the data so that it can be used as training data for an AI. So in that case, they're data providers. I also have some clients who are on the other end where they're AI users. So they're wanting to use AI to de identify their data.
Hmm.
Maybe they have medical transcriptions or doctor's note, that sort of thing, or patient feedback that they give on a website or something. And they've got a lot of this data. It's going to be tedious to have a person go through and de-identify everything in there. So they want to use some sort of AI service to strip out the identifiers.
Okay.
The problem is that sometimes works really well and sometimes it works poorly. So that's why some clients would contact me to evaluate how well the de-identification tool works on their particular data.
Okay. And you've been doing this for quite some time, right? And I often like to provide some input or advice to young folks that are, let's say, they're computer science majors, they're still in college, maybe they're juniors or seniors. What advice or recommendations would you have for them, just overall from your perspective and what you do?
Wow. So what I do is very narrow. So I don't know if I would recommend someone going into specifically this, but it's certainly a good idea to get an idea of how data works.
Or maybe
And
how did you get into it?
yeah, so I started out in applied math. Started out as an academic. I was doing differential
Okay.
equations research and all that stuff.
Smart.
I I left academia, ended up working as a programmer, and then working for a hospital in biostatistics. So that's when I first heard of HIPAA. That's when I first started working with patient data.
Okay.
Yeah, and then I left and went out on my own. But
Awesome.
one thing I would advise people, students, is to really get a handle on probability. A lot of people want to learn data science, they want to learn statistics. That's going to be a lot easier if you just really have probability in your bones. If you thoroughly understand probability, then the statistics comes a whole lot easier.
Okay. Yeah, statistics was a very hard course for me in college, and so I take my
Yeah,
hat off to
well,
you if you're smart in that.
I know a famous statistician who told me that she was just bewildered by her first statistics course because it all just seemed so ad hoc and there wasn't much context.
Okay. Awesome. Well, I really appreciate you taking time out of your day to provide us with some insight around some of these data privacy laws and rules, and also how you can HIPAAify your data, right? Removing the safe harbor identifiers and things like that, which is super critical nowadays if you don't want to be hit with a large fine. If you have that non-identifiable data, or that data that is able to be identified, then you definitely don't want to provide that information to an organization as well. So one thing that I do want to let the listeners know is that we do have a backup and recovery professionals LinkedIn group. There's about 26,000 people in that group. So please do go on LinkedIn and type in backup and recovery professionals. We're having great conversations, just like the ones we're having right here on Data Protection Gumbo around cybersecurity, data protection, backup recovery storage, AI, and even sometimes blockchain, right? So, John, we really appreciate it. And maybe a final shout out from you.
All right. Well, if you'd like to find out more from me, my handle's John D. Cook everywhere. JohnDCook.com, John D. Cook on Twitter. Just type that into your platform and you'll probably find me.
All right, John. Thank you so much again.